For more on the measles outbreak, let's bring in Dr. Helen Chu with UW-Medicine. Dr. Chu, thanks so much for joining us this afternoon. How concerned are you to hear about the first death from measles in a decade?
Well, it's certainly concerning to hear about any type of death from measles because it is completely vaccine preventable. So if children get their vaccines at age 1 and then again at age 5, the vaccine is 95% effective. So really, nobody should be dying of measles these days.
Uh, Why are we seeing so many cases right now?
Because of the rising vaccine hesitancy in the United States and globally, a lot of children aren't getting their full doses of their measles vaccines before school entry. And what that's leading to is cases that are occurring in these undervaccinated populations, like we're seeing in Texas, and also have seen in the past, like in Clark County in Washington State a few years ago. And since measles is so transmissible, what happens is that once there's one case, it's highly likely that somebody who's unvaccinated around them will also become infected.
Well, you just mentioned that the measles vaccine is very effective. I'm curious about adults, though, people who perhaps were vaccinated as kids. Do adults ever need a vaccine booster for measles?
So adults should be protected from measles. They can check their vaccine records and their immune and their history of vaccination. But for the most part, adults should be already protected.
Okay, and you did say it's very contagious. So if someone does know they've been around someone with measles, what should they do?
Well, I think if you are around somebody who definitely had measles or are concerned that you were around someone like what happened in January at SeaTac Airport where there was a traveler who had measles, then you should contact your healthcare provider. If you're starting to have symptoms like a rash or fevers, at that point you should contact your provider, but definitely not go to clinic at that point because you're likely to be able to be highly contagious and transmit to others.
All right, Dr. Helen Chu from UW-Medicine, thanks so much for joining us this afternoon.